Dementia and dysphagia, two terms that can be confusing for family members and loved ones diagnosed with these. What does it mean, and where do we go from here? Let's break down some terms. Dementia is a combination of symptoms that significantly impact someone's ability to do activities of daily living, or ADLs. There are many diseases that cause dementia. The most common ones are Alzheimer's disease, vascular dementia, and Parkinson's disease. Dysphagia is defined as problems that occur in the oral cavity, pharynx, esophagus, or gastroesophageal junction, basically the most familiar parts of swallowing. Dysphagia can be caused by a multitude of things: cancers of the head and neck, traumatic brain injury, and yes, dementia. If someone has a gurgly voice during or after eating, if they cough when swallowing, or if they pocket their food, they may have dysphagia. As a speech pathologist, there are a couple ways one may be diagnosed with dysphagia. An SLP may observe feeding time, perform a swallow test, or watch someone swallow special dyes that can be observed with fiber optic video. It's more common to see someone with dementia who also has dysphagia in the nursing home setting. Overall, dysphagia can be seen in about half of all dementia cases. However, the severity and time of onset of dysphagia depends on the type of dementia someone has. Since there are many circumstances that can affect someone's ability to eat and comprehend the situation, speech pathologists evaluate their clients on an individual basis. They may look at how advanced the dementia is, the rate at which it is progressing, and the risk associated when eating. Someone with dysphagia may aspirate or inhale their food or liquid, which can lead to aspiration pneumonia. For those with dementia, this could mean death. Additionally, individuals with dementia are already more likely to be malnourished and dehydrated, and dysphagia can further exacerbate those symptoms. In Alzheimer's, the most common disease that causes dementia, an early symptom of dysphagia is called agnosia, or the loss of sense of smell. Since taste is closely related to smell, people with Alzheimer's disease report food not tasting very good. The sense of smell plays a big role in eating, whether we know it or not, and the lack of smell can make meals seem less appetizing. Additionally, memory impairment itself can cause someone to forget to eat. It's important that family members, loved ones, and, if able, the person themselves, are involved in the care plan. Depending on the prognosis, there are a few options someone has in terms of their diet. They may be switched to a diet with specific consistencies: a nectar-thick, honey-thick, or a pudding-thick liquid. If someone with dementia is able to swallow safely, they may benefit from being seated in a consistent place for every meal, or eating multiple small meals a day. Adding spices to foods and making them visually appealing may also encourage someone to eat. There is not much evidence to show that a percutaneous endoscopic gastrostomy tube, or a feeding tube, does not prevent aspiration or even prolong life in those with dementia. When someone is nearing the end of their life, it may be harder for them to eat and drink, especially if they have dementia. Dementia guidelines typically support encouraging someone to eat and drink for as long as possible. By the time they naturally stop wanting to consume things, the care team may transition to comfort measures at that time, such as performing oral care or providing ice chips. Having a family member or loved one with dementia and dysphagia can be frightening. Communication with doctors, speech pathologists, and the care team can help alleviate fears regarding safety and the future. In the end, everyone is there to support the patient with dementia and dysphagia.